Hi everyone, I'm Ines, and today our group is going to present about zoonotic diseases. These are diseases that can spread between humans and animals. They are important to know about because they can affect our health, animals, the environment, and even the economy. Through this topic, we hope to help everyone to understand how the animal and humans' health are connected and why it's important to us to work together to prevent the spreadness of diseases.
My name is Tan Jieshi. Several factors disease pass from animal to human. One key factor is human-animal contact. As people expand into wildlife habitats through deforestation, urbanization, and farming, the chance for pathogens to jump from animals to human increase. Apart from that, another factor is global movement. Travel and trade allow disease like COVID-19 to spread rapidly across continents. Environmental change such as climate shift and pollution also affect disease vectors like mosquito, exposing people to new infections. Furthermore, socio-economic factors will trigger zoonosis. Poor sanitation and limited healthcare will raise infection risks. Finally, intensive livestock farming can amplify pathogens and make transmission easier.
Hi, I'm Jasin. I will discuss some example. Hi, I'm Jasin. COVID-19, likely from bats, causes a devastating pandemic showing how quickly a zoonotic disease can disrupt the entire world. Rabies, transmitted through animal bites, is almost always fatal but is preventable through vaccination of both pets and people. Avian flu from poultry can be severe in humans and causes massive economic losses in the farming industry. Ebola from bats and primates causes deadly outbreaks, highlighting the critical need to monitor wildlife. And Salmonella, a common foodborne illness, comes from contaminated animal products but is preventable with proper food handling.
My name is Zafran and I will describe the impacts of zoonotic disease with three aspects: individuals, economy, and psychologies. Zoonotic diseases are illness that spread from animals to humans, like rabies, avian flu, and COVID-19. They are very deadly, and even the survivor often suffer from long-term effects such as breath problem, low immunity, and weakness, which lower the quality of life and also can affect their family. How about impact in economy aspect? Government will spend a lot in the hospital facility, in medicine, and also in vaccine to make sure people in that country in the pink of health. Then many workers lost their job and also lost their income because they are sick and in quarantine session. Other work like office work, tourism, farming, and travel also slow down frequently and will hurting both family income and the national economy. Lastly, impact zoonotic diseases in the aspect of psychology is all people live in fear. This situation will contribute people to be more aggressive. For instance, while PKP orders have announced by our Prime Minister in the COVID-19 era, all people go to the shopping market to buy the things that they need before it's out of stock, without thinking the others. People like this will be so selfish and also can contribute to discrimination if the government didn't take any initiative to overcome it. Other than that, all schools closed. The business ongoing at that time will slow down frequently, end up stop immediately. And all people have to adapt with new lifestyle, which is new normal, in order to protect themselves and their family. This situation, people will experience stress, anxiety, uncertainty about their status, health, and their future.
My name is Nicole Yanding. Preventing zoonotic diseases require a two-part strategy, combining personal responsibility with strong public health system. On a personal level, you must practice impeccable hygiene, especially washing your hands after contact with animals. Always cook meat thoroughly and avoid cross-contamination in the kitchen. It's also vital to avoid contact with wild animals and to use insect repellent. However, individual actions are not enough. We need robust public health measures, including continuous disease surveillance in animals and human populations. Governments must invest in public education and animal vaccination programs. Finally, international cooperation, stronger policies regulating food safety and wildlife trade are essential for protecting global health. By combining vigilant personal habits with these systemic defenses, we can effectively reduce the risk of zoonotic diseases.
To conclude, zoonotic diseases are a serious problem that affects both humans and animals around the world. By learning about their causes, effects, and prevention, we can help make our world safer and healthier. Working together and spreading awareness are the best way to reduce the risk. Thank you for listening and watching. Bye!